Hi, today I'd like to talk about autism spectrum disorder, also known as ASD. ASD is a group of disabilities that can cause significant social and behavioral and communication issues in children ranging from infants all the way up to adults. Autism is one of the most severe forms of ASD, but there are also other disabilities that are considered ASDs. Three of the most common are Asperger's, Rett, and PDD-NOS. These are all forms of ASD. Uh, ASD can affect anybody of any ethical or social economic groups and all ages. It's estimated that 1 in 88 children age 8 will be diagnosed with some form of ASD. The signs are usually noticeable in the first 3 years of the child's life, but they vary in character and severity from one person to another. There are many forms of therapy and treatment that are available, so it's very important that it's detected early in a child's life so that they can get the therapy and treatment that's needed. Autism spectrum disorder is a generalized term used to group for a group of brain disorders, brain development disorders. These disorders can affect social interaction, repetitive behaviors, verbal and nonverbal communication, and all to varying degrees depending on the disorder. ASD is a diagnosis that is now used for all the autism disorders with different subtitles. The DSM-5 diagnostic manual that it was published in May of 2013 was the one that changed all these disorders and made them so that they were all in one group. So it's the disorders are the autism disorder, childhood disintegrative disorder, pervasive developmental disorder, which is the PDD-NOS, and Asperger's syndrome were all grouped as part of all ASDs. And this information can also be found in autismspeaks.org. There's a lot of good information on that website as far as the different forms of autism. Some of the signs of autism to watch for, according to the National Autism Association, would be things like if a child doesn't wave or make eye contact, if they don't smile when you smile at them, if they don't respond to your name, follow objects visually, point or wave, make noises to get attention, imitate or respond to cuddling, imitate facial expressions, reach out to be picked up, play with other people, or even ask for help. These can all be signs that there is a ASD present. There are several ways to ensure that ASD is detected early in childhood. Developmental screening should be done throughout early childhood, and that's some of the screenings that the doctors do in the offices. That's why they ask all the questions that they ask. And these are to find out if a child is learning what they should be learning, reaching their milestones, and if there are any developmental delays present. During the screenings, the doctors will ask the parents questions and talk about what the child is able to do so that they can identify these disorders early so that the child can get the help that they need. They're usually screened for ASDs around 18 and 24 months because by then you should know whether or not a child has some kind of developmental delay in these areas. Different levels of ASD would be the autism spectrum disorder, which consists of 5 conditions that are all very similar, ranging from high functioning, mid functioning, or low functioning, depending on the severity of the symptoms. The five different diagnoses would be classic autism, pervasive developmental disorder, Rett syndrome, early childhood disintegrative disorder, and Asperger's syndrome. And this information can all be found at thehealthguidance.org. where you can actually read more about each of these disorders. So, but I'm going to talk a little bit about the actual classic autism. Classic autism is the one that causes the most severe problems. Children can be very limited in what they can do. They don't function well. They can't communicate, may not even use any words at all. They can be in their own little world, unable to do anything but be there. May not even be able to show any kind of emotional interaction at all. And that's why this is the most severe of the syndrome. The thing about autism is you really need to catch it early. There's therapy that can be done, and these children, early intervention is the best way. It can be done through therapy, play, different schools. There are many schools that are able to help these children learn what they need to learn. And if it's not caught early, you lose a lot of time where you could be working with these children. So please make sure that if you know anyone with a small child that seems to be struggling, seems to not be communicating, won't show affection, any of these things, talk to the parents. Let them know that they should be getting these children some help, getting these children screened, because early intervention is definitely the best way to handle autism spectrum disorders. So, and there's nothing, many children, this can happen to anybody. It can happen to you, it could happen to me, it could happen to any of our children. So please, if you know somebody that needs this kind of help for autism, please get them the help they need. Thank you.